thrilled last month to have been at the ribbon-cutting ceremony for the amazing, brand new Beekley Center for Breast Health and Wellness at Bristol Hospital. With us is the Director of Diagnostic Imaging and Laboratory Services with Bristol Hospital, Rebecca Wiesner. Rebecca, good afternoon.
Good afternoon to you, Mary.
Well, thank you for joining us today, and congratulations to you all. What an amazing facility.
Oh, thank you so much. We're thrilled to be a part of it and to be able to offer it to our community.
And you must be so proud. It is unlike any other breast health and wellness center I have seen.
Absolutely. We built it with women in mind and had a lot of input from breast cancer survivors and what they would expect from a center that's comprehensive and will meet their needs for all of their breast health and wellness items they need.
And one of the things, and I'm thinking of several things that I was so impressed with. We'll get to the fireplace later on, Rebecca. But I remember just being quite amazed at the fact that a woman can go there for her exams, for her tests, and that the physicians are right there.
Absolutely.
It's all together.
Yes, we try to make it a collaboration amongst the radiologists, the surgeons, and even we're offering a nurse navigator, so someone who's there to educate patients on their breast health and, any procedures they may be having. So it's really a collaborative effort amongst our, surgeons, radiologists, and our nurse navigators for the patients.
Now, who was involved, Rebecca, with the actual planning and the design of the center?
Right, so it really ranged from all of our stakeholders and benefactors who, had donated funds for the center. The Beekley Corporation was one of the donors. And then, it ranged all the way from the operational techs who were going to be working in the center to the physicians who were involved. And we also had some breast cancer survivors who were there to help us coordinate the flow of the center and also the amenities that were going to be offered at the center.
It was so nice when I was there. I've been friends with Ann LaPlante, the CEO of the Beekley Center for Beekley Corporation for years and years, and she's a woman who knows how to get things done.
Absolutely. She was, a big, benefactor for us and helped us, with the overall strategy and what we envisioned for the center over the last few years, and it's really great to see it come to fruition.
Talk a little more, Rebecca. We're speaking with Rebecca Wiesner, the Director of Diagnostic Imaging and Laboratory Services with Bristol Hospital, about the brand new Beekley Center for Breast Health and Wellness. You touched upon some of the amenities, but talk a little more because I know there are so many.
So we offer from basic screening mammography to any kind of biopsies needed or ultrasounds for dense breast tissue. We also offer surgical services. So we have a board-certified breast surgeon on site. We have radiologists on site, and we're hoping in January to offer massage therapy services as well. It's really a spa-like environment for our patients that meets all their needs for breast health and wellness.
And the team, and I know it is the team approach that you have built into your facility, what does that consist of in terms of the different specialties?
So we have, again, as I mentioned, a board-certified breast surgeon. We have all board-certified radiologists there to view screening mammograms and any diagnostic mammograms that are completed, all the way to ultrasound images and other X-ray images needed for biopsy purposes. They're all there to collaborate and provide the most comprehensive care for the patients through their journey.
Nurse navigators as well, which are just, talk about the support and the information at a time when emotions are running high. It can be very fear-based, obviously, and so your team approach and collaboration is invaluable, Rebecca.
Absolutely. The nurse navigator's role is extremely important within the center. We utilize our nurse navigator, Kathy Albano, who just started with us, to not only educate patients from maybe a simple biopsy all the way to a patient who's been diagnosed with breast cancer, to assist them with not only the education they need for each of their procedures, but for their transition and their journey through breast cancer and all of those other places that they will need to go and be treated at within Bristol Hospital, from their oncology to any other follow-up procedures that are necessary for their journey. And it's really helpful to have that person there to help those patients and hopefully calm them and provide them with an education necessary for any treatments that they may have.
Oh, absolutely. And in the area of breast cancer, touch upon the early detection, because, you know, there is, and isn't it wonderful, Rebecca, to be able to say this, there has been such enormous strides, and I've been told this by so many folks over at Bristol Hospital over the past even 10 years alone in terms of breast cancer. You know, it no longer needs to be that death sentence that it was 20, 30 years ago, but early detection is pretty darn important.
Absolutely, and that's where really we start. You know, screenings are so important. It's so important to follow up with your annual screening for your mammograms, and that's really just a start. We see a lot of women who even have dense breast tissue, and we do ultrasounds for them. So we try and catch things, you know, early on. In addition, our radiologists typically go back almost 5 years to look at a progression of women's breast health to make sure that there's nothing that's missed and that, you know, once we find something, we can, you know, actively treat it in a variety of different ways. And again, that's what improves the survivorship rate for women across the nation.
And also, we need to just comment that breast cancer is not limited to women. We tend to think of it as a woman's disease, but it is not.
Absolutely. The center is, you know, conducive to both women and men, and we absolutely see both of them at the center.
Now, Rebecca, the spa. Mm-hmm. Let's get to that fireplace that I mentioned earlier, and the spa ambiance. That obviously was very intentional in its design, and boy, is it wonderful.
Absolutely. As I mentioned, we had a lot of input on the center and how we were going to make it as calm and as inviting and embracing as possible. We want people to feel comfortable and, you know, well educated, and just we wanted to give it a spa-like environment so that people felt that they could come in, relax, get their traditional screening done, and, you know, feel it the best that they could. And, you know, as you mentioned, we do see women who are a little more progressive, or maybe they're recently diagnosed, who wanted to give them as calm a feeling as possible while they're going through that journey within the center. Because
that the feeling as a result of the design that was built at the Beekley Center for Breast Health and Wellness, it's a very different feeling, Rebecca, and you experience it every day. You're one of the lucky ones who works there. Yeah. But it's a very different feeling than going to a doctor's office and sitting in a doctor's office waiting room.
Absolutely.
Totally different.
And there's really a lot of research out there pushing, you know, the industry towards that service environment where, you know, people come in and they just heal better when they feel more calm. You know, I've heard a lot of our employees even say, I love working in here because it just feels so nice and relaxing. And you know, of course, that's how we want our patients to feel.
I heard that from many of the employees also the day that I was there, and I was getting a tour, and you know, so many of the employees were just touting the fact that they were so proud and so happy to be working there, and so isn't that wonderful? And that's the way patients will feel as well when they go. Rebecca, I'm going to put you on the spot for a moment, and I say this because I don't know what specialty you are in. Are you a nurse, or are you an imaging person? I know your title is Director of Diagnostic Imaging. You mentioned a moment ago dense breast tissue. I was going to ask you, do you have a sense, and I won't hold you to this, what percentage of women roughly have dense breast tissue? Because that's something also that we need to remind women to find out if they do or not.
Yeah, I don't. My background is actually in medical technology, just to start. But I've been able to branch out. I've been in healthcare for a very long time. But as far as the definitive percentage, I don't know exact numbers, but I do think it's somewhere between 20 and 30% of women, if not a little higher, that do have some dense breast tissue. So really, the gold standard for that sometimes is to do your annual screening, your mammography, but then sometimes to follow up with an ultrasound afterwards to make sure that there's nothing that's missed on that traditional X-ray film on the mammogram. So that's typically what we do for women who have dense breast tissue. And if you do know that you have dense breast tissue, it's something to bring up with your provider just to make sure that, they've requested a follow-up ultrasound if necessary. Or it is something that our radiologists may see on the exam, and they typically will follow up with the ordering provider for that mammogram to request an ultrasound if necessary.
Very, very important. Rebecca, thank you so much. Congratulations again on the new Beekley Center for Breast Health and Wellness being open. It opened just last month. The website is bristolhospital.org. I put a link to that on ours this morning, so it'll take you right there, but it is bristolhospital.org. And the phone number is 860-585-3999. Am I correct on that, Rebecca?
That's correct.
860-585-3999. Thank you so much for joining us today.
Thank you for having us.
Thank you. Rebecca Wiesner, Director of Diagnostic Imaging and Laboratory Services at the new Beekley Center for Breast Health and Wellness. And it is a very impressive and quite amazing facility.